come on.
This one just finished his night duty and he's looking so tired. Guess what? He's going to newborn tomorrow. He's doomed.
Newborn baby. You're such an newborns are fragile. So what is your
And then there's this young woman.
I'm going back to the world.
So hi guys, if you're new here, you're very much welcome to my channel. Okay, I am Dr. Ngm, Dr. Njoku Martins, Ngm for short. I am very much welcome to my channel. So I'm finally done with children emergency posting. I legit started pediatrics children emergency ward posting around 2 weeks ago, yeah, and I entered CHU feeling, I don't know what the word is, but people that had always or that did children emergency before I did were always complaining, saying, well, you have too many patients, you have to do night calls alone, you're the only doctor in CHU, you have a lot of rowdiness, a lot of patients need your attention almost at the same time, and all of that. Well, when I went in, I feel like my own experience was different, and the experience of the people I did CHU with. So previously it used to be like 3 persons, but in my time it was 4 persons, so we were 4 doing CHU at the same time. Do you get? But we were not all on call at the same time. Like in the mornings now, say from 8 a.m. till 4 p.m. you have like 2 doctors, 2 house officers on CHU. Then in the night you have somebody else, just one individual from 4 p.m. till 8 a.m. the next morning, yeah. And well, no matter how much you look at it, it's still a lot, do you get? Because just one person managing CHU at night. If you don't know what CHU is children emergency ward, do you get? Or it's still also called chair, children emergency room. Yeah, so it's still a lot for anybody doing CHU alone, do you get? Because initially when I was doing pediatric surgery, we were always giving consults to come to CHU, do you get? And in those times it was usually very rowdy, do you get? Imagine coming there asking for maybe a patient's folder and nobody's replying, because every single person, both nurses, doctors, are legit very busy, do you get? So it was usually always a lot, do you get? And with children you just have to be very careful, do you understand? I know generally medicine requires a certain level of certainty, but with children you had to add extra caution, do you understand? Their medication dosages are usually very individualized and all of that, yeah. So I feel those were my challenges here, yeah? The children being involved, how rowdy the chair could be, yeah, and just only you being the doctor on call, do you get me? So I feel, yeah, and then going to a new place literally, do you get? Not knowing how your chiefs would be, your regis, senior regis consultants and all of that, do you get? So yeah, those were my fears going in, but some of my fears were actually proven correct, yeah, but I would say I was still able to survive the 2 weeks in chair posting thanks to a lot of factors. Now, the first thing I learned before going into chair posting was that you have to always chart your drugs. I don't know who, I know sometimes you can forget. Believe me, trust me, sometimes you can forget. You have a lot of patients and you're going to each patient's bedside giving medications and all of that, do you get? And sometimes maybe after running all the errands, still having emergencies that you have to attend to, do you get? Still having bedside investigations you have to do, do you get, for these patients and keeping record of all of them, plus word round. Do you get? You might get carried away and forget to chat one or two medications. Do you get? And that's a terrible problem. Do you get? I wanted to say huge, but it's actually a terrible problem for you, because it could earn you more time in children emergency. It could earn you more calls, literally. But thankfully, I wasn't found wanting in that regard. Do you get? Well, I would say my posting or my time in children emergency would, what's the word now? Trying to look for the word. I would say it just taught me a lot. Do you get? In my entire time there, we lost 2 patients, and I know we've talked about it before, about this presentation to the hospital. I feel like with adults it's different, but with children, my God. So we had a patient, let me use this as an instance. We had a patient here. The child had fever and child was very, very irritable. So the parents took her to a traditional herbalist. There's something they call a powerful. I don't know how to describe it to the best of your ability, to the best of your understanding, but like, okay, a patient is having abdominal pain, literally, maybe becoming so irritable, throwing up, vomiting, stooling countless number of times here, and you take the child to a herbalist. So this herbalist uses like an iron, uses like a very hot iron and presses it on the child's abdomen, on the child's belly, in an attempt to stop the vomiting and stooling. Now I want to really understand the logic behind that. How on earth do you think putting hot iron on your child's abdomen will stop vomiting and stooling? How? Would you as a parent do that to yourself? I don't know if you get me, but like a lot of things, and the 2 patients we lost were because of the same thing. Do you get? So your child was sick or has been sick for a very long time, and you couldn't bring the child to the hospital. Maybe you didn't have enough finances, do you get, or you were ignorant. One patient specifically told me today that she didn't know that hospitals could treat convulsion. I was shocked. I was stunned. I was checking the patients, the child of the mother, and she was telling me about a child that she had lost. Do you get? And she told me, I don't know. I didn't know hospitals could treat convulsions. And I was like, wow, for real? So what are hospitals for? So if your child has convulsion now, you take your child to a herbalist. I just couldn't wrap my head around it. But I was grateful. I was glad she came to the hospital for this her other child that was sick now. Do you get me? And the most I could possibly do was to counsel her on the importance of a hospital and what a hospital is for. Do you get? I don't know. Being in chair really opened my eyes to a lot of, what's the word, ignorance of parents. Do you get? And it made me start wondering, are all adults actually ready to or really understand what it means to care for a child? Do you get? Because why bring your child after taking your child for, let's say you took the child there for 4 days, the child wasn't feeling well, you took the child to another place. Okay, that person does not know what he is doing well, or the iron he's using is not hot enough for the child. You take the child to another herbalist or another place for the same apple or whatever it is they call it, and the child did not get better. And you went yet another time to another place. I'm like, when is it going to dawn on you to bring this child to a hospital? And the funny thing is that when they finally bring this child to the hospital, they expect you to work magic. Do you understand? They expect you to just, with the snap of your finger, make the child better. At a certain point while I was giving medication to one of these patients, the dad asked me, "Doctor, Shebi, my child is going to start," because the child was literally unconscious. Parent asked me, "Shebi, doctor, my child is going to start talking normally or start acting normal very soon." I'm like, God. I just asked him a question. When you brought this child, how was this child? Because while the child was in the hospital, it felt like the child was recovering somehow. Do you understand? And I understand that there was no money, but I don't know from wherever money said coming out. Do you understand? So this money could it be because of finance you did not want to come to a hospital? Because I know in my heart of hearts, if you take that child to all those herbalists and all of that, you still have to give them money. Do you get me? I understand things are not so rosy, things are not so cool and all of that, but guy, it is your child's life we are talking about. Do you get? And I don't know, coming into work today, I did day today, and coming into work, I just saw the parents' face, and I just knew immediately that something terrible had happened. Do you get? I did night like 2 days ago, yeah, and coming into morning duty today, and I was told that the child had packed. I don't know. Would God blame the parents now for bringing this child late? Because, like, I don't. So please, I'm pleading. Yeah, I understand that things about children can be a little bit dicey. Do you get? Maybe if your child is sick, you may want to, let's watch him for a couple days. Yeah. Let's watch him for a couple days. Give paracetamol, give this. If after 1 or 2 days your child is not feeling better, take the child to a hospital. Do you get? That money you're claiming will not be available, or this money will not be available, or I don't know what your other fears would be. Do you get? Or they are going to waste my time. Do you get? Just bring the child first. I know that you'll be glad you did bring the child on time to the hospital. Do you understand? And to all doctors working this year, I'll also encourage you to also counsel patients as well. I know that our chiefs may be overwhelmed sometimes with all the work they have to do and all of that, maybe counseling these patients. And two, I also feel too that they've seen a lot of this. Do you get? They've seen a lot of this kind of cases. Do you understand? And at a point, I feel they are indifferent to it too. So it behoves on us actually to counsel these patients a little more. Do you get? Because they will have another child, and they may still make the same mistakes with this child. So we're clocking a patient one time, and the mother told us, I just took the child to APA for something, or that she doesn't know what is wrong with the child and all of that. But you took the child to APA for, and then after that she now told us, I did it to the other daughter, not the older daughter. Do you get? I did it to the older daughter and all of that. I'm like, wow. She was even bold enough to add this information, and my chief was like, so you even have the guts to tell us that you also did it to your other child. And one thing I've noticed is that it's very common in this part of the world. You get? I don't know how it is in your center, but here as I am, I've I've seen a lot of cases. Because even while I was in surgery, there was a patient that came in with intestinal obstruction, yeah, and appendicitis as well. Yeah, so after the surgery and all of that, okay, we made a diagnosis of appendicitis, yeah, but going in, the number of adhesions the child had, not the child now, the man, the boy, it was a full-fledged boy, yeah, made us stay even longer in the course of the surgery, yeah, and yeah, when he finally came out, he was now telling us about the powerful or something like that. I feel it's very common in this side of the world, but why? Because I don't feel like it's because of the lack of hospitals. Yeah, I know in my heart of heart there are hospitals. Is it that maybe it's just a tradition? Do you get that if your child is sick or if any of your children is sick, take the child to a herbalist and they are going to do this? And I wish, yeah, I would be able to see one of these people that does these things. Maybe go to one of their places and see how the thing is done. You get, and maybe ask them questions. And two, sometimes it might just be a needle or iron they used for a previous child without sterilization. They'll use it for your child. You don't know what the other child has. You don't know. Oh God, I was literally sad. Do you understand? Early this morning coming to work, and my colleague was telling me about how the child just started getting bad and worse over time. You get checking RBS, you're getting a random blood glucose of what is it called, of 24, of 12, and it just kept coming down. Even after a lot of transfusion and all of that, there was still, oh God, terrible actually. Chickens. So I don't know. As much as you can only counsel, you can only talk. Do you get? That is as much as you can possibly do. Do you get me? But then so my experience so far in pediatrics, so true still part of pediatrics, do you get, has been, there's no word to actually classify it. I've been thinking about one word to just group it. It has just been bittersweet somehow. Do you get? It's been chill for the most part. Do you get? Sometimes you come to chair, there are not so much patients. Do you get? And you can be able to cover for the wards that are there. Do you get? But then, oh, we'll talk about pediatrics later, but my chair posting was actually chill, but I dare not say, because, well, the stress part, obviously now, the stress is too much. Do you get? Sometimes you come to work around 4 p.m. and you keep working till even around 4 a.m. you've not sat down. Like, you've not sat down to even take water or something like that. And this is not a case where you say, okay, patient is coming in and you're on break or you went to eat or something like that. Nah. You have to take care of your patients. But damn, the stress was something else, actually. There's some nights, yeah, I come back from call and I'm like, I just sleep till the next morning. Do you get? It can be that bad. Do you get? I just want to be indoors, stay in bed and all of that, because I don't know, I feel like it takes more than just your physical energy literally to do this kind of work, because I don't know, it just rubs up on you emotionally somehow. Do you get me? But it's fine. It's okay. So I'm now in ward. Apparently I was thinking to, after chair posting, I go over to newborn posting. That's both outborn and inborn. Yeah, but I don't know. Luckily for me, it's not like that, because I don't know, newborn is another very hectic place. Yeah. Well, ward is also very hectic, but I feel not as much as Do you get? So I'm grateful. I'm glad I'm back in the ward. So I would continue my ward rounds, like ward rounds with my team apparently, and all of that. But yeah, maybe after 2 weeks I can go to newborn, depending when they or if they put me up in the roster and all of that. Well, I guess that's that. It's like, well, it's been more than 2 weeks now. It's like 2 weeks and like 4 days or something now in pediatrics. Yeah, in pediatrics. And yeah, I can only hope that it gets better from here. I can only hope that I meet good people ready to teach, yet not ready to punish and all of that. Oh God. I miss surgery. There's no other way to put it. The only good thing I feel about this pediatrics is that it has organization. Because it has a form of structure. In surgery now, I can be on call on Thursday, Friday, Saturday, Sunday. And still be expected to come to work on Monday. And those Thursday, Friday, you'd have patients on Thursday, you'd have to do surgery that can last you till like 1 a.m. in the morning. Friday, you can also have another patient and you have to do surgery to running around and all of that. You can also have patients on Saturday, Sunday, and still come to work on Monday with all that exhaustion. But in pediatrics, say you do morning 8 a.m. to 4 p.m. on Monday, do 8 a.m. to 4 p.m. on Tuesday. On Wednesday, you do nights, that's 4 p.m. till 8 a.m. the next day. Then you're free the rest of the day. They actually consider you enough to give you time to go and recuperate. Even if it's a little, before you come back the next morning. So I feel that organization alone is something I like. But surgery, it doesn't afford you, but still I'll pick surgery any day. Sorry, we've not gotten to that, but still, so far. I'll tell you why in another video. But for now, I think that will be all. Yeah. If you're yet to subscribe, do want to subscribe. Yeah. And if this video has taught you a small lesson, please just give it a thumbs up. Yeah. And I'll catch you guys in the next one. I'm exhausted. Let me sleep. Literally. Peace.